The companies that make up the pharmaceutical industry are among the largest corporations in the world. Together, these businesses have come to be known as Big Pharma. In 2004, their combined global sales were over $500 billion, with Pfizer and Johnson & Johnson leading the pack. In the U.S., the core of Big Pharma's immense profits is from sales of prescription medication. And since these drugs can only be prescribed by medical professionals, most of the industry's promotional and marketing activities are directed at doctors, pharmacists, and other healthcare providers.
This starts out at the first day of medical school, and in many medical schools, even the incoming students that, are 2 years away from seeing a patient will start to get gifts from the pharmaceutical industry. And as these students get farther along in their medical education, the interactions and the gifts escalate to free lunches, to dinners.
Champagne, brunches, happy hours, New York jet tickets. No matter where you spend the money, you make money. And my boss always told me, don't worry about it. There'll always be more funding. Spend what you can. In fact, if I give you $100,000 to spend, Gene, I want you to spend $200,000.
Before 1980, most clinical research was funded by the National Institutes of Health. During the 90s, most of that research got pulled out of universities and was brought to for-profit research organizations. The problem is that gave virtual complete control over the research to the drug companies. They could design the studies. They have control of the data, so that many of the authors of the most important articles published in our best journals aren't even allowed to see their own data. They don't get free access to their own data, and they have control over publication.
To sum it all up, the pharmaceutical industry first gained control of the teaching system. Then it gave the AMA the power to exclude all other doctors from practicing. Then it took over the entire drug testing process, while heavily influencing the medical publications that reviewed those drugs. And finally, Big Pharma extended its control over the federal entity that is supposed to verify those drugs' safety and efficacy. At the opposite end are the sick citizens, and in the middle are the doctors who must cure them based on information they can only get from the pharmaceutical industry, which can no longer be verified. Chemotherapy drugs are in fact among the most expensive of all. A 1-month supply of erlotinib, a chemotherapy drug produced by Roche, cost $2,300. The same supply of sorafenib, Bayer's chemotherapy drug, costs $5,500. The monthly supply of sunitinib, a chemotherapy drug produced by Pfizer, cost almost $7,000.
The drug industry is the most successful global industry in the world. What they don't want you to do is get better, because if you get better, their market's gone.
Fear. Its darkness causes humanity to make awful choices. With dreadful power, fear can rule our lives and paralyze lofty hopes and dreams in an instant. A global affliction, and deployed all too often by those intent on inflicting control over the masses.
Fear preys on the most vulnerable among us. Fear sells, and nowhere is fear peddled more shamelessly than in the fields of medicine and human nutrition.
Fear anesthetizes us. It coerces us, making us believe that we can do little on our own to prevent or treat disease, and forces whole nations to kneel at the altars of the drug industry.
And of course the fearmongers are also preying on fear of disease. And the solution that the fearmongers give us are drugs.
As if by design, health choices are limited, information is scarce, lives are ruined, and the truth be damned. The fear machine is well oiled by petrochemical dollars and a near worldwide monopoly in healthcare. It works overtime to prevent the truth about dietary supplements from getting out to the public.
Anything that comes from nature cannot be patented. They're not interested in that. So, we translate that into the real world of FDA approval. Surely these drug companies aren't going to spend $20 million or more testing any substance from nature because it can't be patented. That, and of course the FDA says it's illegal to use unless it's been tested for efficacy and safety. Now you see the catch-22 you're in there. Nothing from nature, regardless of how effective it might be, will ever be proven safe or effective according to the FDA. It'll never be. Because nobody's going to spend the money to go through the test. So therefore, everything from nature will always be condemned by the FDA as unproven. An unproven cancer cure.
In a small town in northern Ontario, the year 1922, Green Case first learnt of a cancer remedy which she termed ESSIAC.
Unbeknownst to history, this fragile Canadian nurse has heroically managed to cure thousands of people from cancer with a simple concoction of herbs. While nursing an old patient, Renee noticed that she had a scar on her breast. The patient said it was left over from a cancer she had cured over 30 years before, using a mixture of herbs suggested by the medicine man from the local Ojibwe tribe. Renee tried the same formula on her aunt, who had recently been diagnosed with cancer.
I went down and I asked Dr. R.O. Fisher, who later was Dean of the University of Toronto, if he would watch over her, if I would try some of these herbs. And he said he would. And it took quite a while, but she got better. And she lived for 21 years.
After that successful experience, Renee quit the hospital and began curing people with a mixture of herbs that would become known as ESSIAC, which is her last name, spelled backwards. Soon, the voice spread, and the number of patients healed from cancer started to multiply.
In about 1943, I was diagnosed in Toronto General Hospital as having a growth in the bowel which was inoperable. And that was in January, and my husband was told that when the snow was gone, I would probably be gone with it. So through friends, I was directed to Miss Case, and I came to her and had treatments from her for practically 3 years, and felt I was cured, and I've had no return of it since.
Dr. R.O. Bastida of Bracebridge sent me a patient, cancer of the bowel, Bert Rosen, and I cured him. So Dr. Bastida went before the town council and mayor and persuaded them to give me a building that they had taken for taxes as a clinic, that I had made a great discovery and that I should be supported in my own hometown. So they set up the clinic where I treated for 8.5 years.
In a few months, the clinic was fervent with activity, with patients flocking in from all different places.
Her clinic would be full every time we were there. And there were people came in ambulances who were not able to come in for a treatment. She would have to go out and administer the medicine out in the ambulance. Then as the time went on, we watched these people be able to walk in. And finally, they were driving their own car to get SCI.
I treated from 300 to 600 patients a week. And the only way they would allow me to do this was free of charge, and I had to have a doctor's diagnosis for every case I treated.
So we brought the diagnosis to Nurse Case, and I took treatment from her every week for about a year. And I have no cancer today.
It was one Dr. Leonardo from Buffalo who had immediately recognized the potential of Renee's cancer cure to warn her of what was waiting ahead.
Dr. Leonardo, he was a cancer surgeon, and he said, "You think you have a cure for cancer?" I said, I'm way beyond thinking I know. Then I had 5 other doctors in examining patients, and he asked if he could go in with them and examine patients, and I told him he could. So then he told me, he said, "You have it, but the medical profession will never let you do this to us."
After a while, a mysterious group of entrepreneurs showed up, offering Renee $1 million for the secret formula. But she flatly refused, as they would not guarantee that her cure would be made available for free to anyone who ever needed it.
Green case was called before the legislature in 1938 to determine ESSIAC's legal status.
I was trying to legalize my treatment, and the patients went out and got this petition signed, 55,000 names on it. And I went before the legislature and I lost out by 3 votes.
Public outcry forced the establishment of a cancer commission to investigate herbal remedies. The greatest majority of Reen's evidence was rejected.
You see, they said the doctors all made mistaken diagnosis. That's why the patients thought they were cured. I kept on my clinic as long as I could until they stopped the doctors from giving a diagnosis, and then I had to stop. And it's a sad thing when somebody comes and they have somebody that is ill with cancer and the medical profession can do nothing for them, and they beg of me to treat them. It's a very, very sad thing to turn them away. And I had a nervous breakdown over that, so I really had to stop. I don't see how they can refrain from recognizing it, because if you have the proof, you have the diagnosis from the doctor, you have the pathological findings, and you find you have the living patient to show that they are still alive after the medical profession has given them up. And yet they refuse to admit that it is a cure.
After she recovered from the breakdown, Renee started again from scratch, brewing the herbal mixture and curing patients in her own basement.
I have to grind them. I used to get them already ground.
Soon the authorities began harassing her again, having her arrested more than once for the most preposterous reasons. But the fame of ESSIAC had already crossed the border, as one day Renee received an invitation to scientifically test her herbal remedy from a clinic in Massachusetts.
About 20 years ago, 1958, here in this lavatory.
Its director was Dr. Charles Brush, who was also President Kennedy's personal physician and a close friend.
Undertook to study the effects of a drug or an herb called ESSIAC. And we found that it was non-toxic and did have effects in help in the treatment of cancer. And as a result of this...
At that point, Dr. Brush recommended ESSIAC to be tested for toxicity in order to be approved by the FDA as a possible cancer cure. But once the herbs arrived at Sloan Kettering, one of the most important cancer research centers in the country, the process somehow got bogged down by inexplicable delays and eventually never came to a conclusion.
The results that I reported to Reen case were studies in sarcoma 180 in the mice, in which we were looking not only for possible primary inhibition of the tumor, which did not occur, but also for regressions. And there was a very small percentage in a small group of regressions, but we never had the opportunity to confirm this and to see whether we could obtain better results.
Nevertheless, ESSIAC was not approved by the FDA, exactly as predicted by Dr. Leonardo 30 years before.